I'll show you the technique of 1061. I'll show you that because no, the reason why I'm telling you is 532 still has a risk of hyperpigmentation. Sometimes a patient might end up with post-inflammatory hyperpigmentation. And second thing is, there can't be anything worse than patient ending up with a PIH, especially with freckles, because already he has scattered spots. You do something and then it becomes even more dark. Then not, it's not worth. So with 532, so ठीक है, but 532 it is a very fine line. It is a delicate line where you have to use maybe 1 joule. That is what I, yeah, 1 joule, maybe 0.95, 1 joule, 1.2 joules is what we would use for freckles with 532. With 1064, with 2 spot, you can go up to 5 joules without a problem. And believe me, no PIH. And now the latest recommendations for epidermal pigmented lesions is in dark skin, try to use 1064 even for epidermal. Yeah, safety wise, and it is recommended to use in dark skins. लेजर एंड लाइट करके एक बुक है, पता नहीं है, तो उसमें आप देखो, उसमें जो एल्गोरिथम दिया है, उसमें एल्गोरिथम में क्लियरली मेंशन किया है कि डार्कर स्किन टाइप्स 1064 कैन बी यूज्ड फॉर एनी स्किन टाइप. So that is what I would recommend and prefer in this
Actually,
case.
you know what? I began with the blending.
Okay.
Not
Yeah, blend
blending
भी कर सकते हो आप, but ultimately you will not find the
हाँ,
need for
doing all this.
532 at all.
अच्छा.
So because 1064 itself
Yeah,
gives a.
so then we should have a. His photographs also there. He is much more.
Much better than
He's
what
much
he was
better.
looking.
There's a lot of satisfaction.
See, in this case, what I would do is, I'll reduce the spot size to 2 mm. Here also I'll reduce it to 2 mm. Then I'll keep it at 1064. See, now it goes up to max of 13.5. But we will not be using that much of energy. 5.5 is what I would use, maybe max 7.5. Okay. And then, as I said, I would never use 10 hertz because you will be shooting normal skin in between. Okay. So certainly not worth doing that. So probably at 2 hertz is good enough because you'll get boom, 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 boom. That is what will happen. These are very, very fine lesions, so let me just have a look at it. Another thing for freckles, what I find useful is you have your magnifying glass, right?
Yes.
So what we do is, I use the magnifying glass because you know exactly where you're treating.
Achha, you keep it.
I keep my lamp like this, and then I shoot it through. I'm looking through the glass and I'm treating. So you're more specific, more precise. So if you have that, we can use that. Yeah. And always try to do that, because what will happen is, you're not going to, yeah, precision. You're not going to shoot. The theory of epidermal lentigens and freckles and all is, try to use the spot size which is lesser than the diameter of the lesion. Suppose if it is 3 millimeter, use a 2 millimeter spot. For a dermal lesion, try to use as large a spot as possible. Why? Larger the spot, deeper the penetration. So in dermal case like Hori's nevus, you want a large spot size. So no point, there's no role of 2 there. 2 or 6, or 4 or 6. Correct? So that is what you should know. Whereas in epidermal, try to be confined within the lesion.